This area is the femoral triangle. This is the anterior compartment of thigh. The muscles on the anterior compartment of thigh are, this is sartorius muscle, sartorius, this is pectineus, and this is iliopsoas. If we remove sartorius muscle, we can clearly see the iliopsoas muscle. This is the iliopsoas muscle. This is the femoral nerve, femoral artery, and femoral vein. Now these are the quadriceps femoris muscle. This is the rectus femoris head of the quadriceps femoris. This is vastus medialis, which is medial to the rectus femoris. Vastus lateralis, which is lateral to the rectus femoris. And deep to the rectus femoris, the fourth head of the quadriceps femoris is the vastus intermedius. And they are forming a combined tendon for their insertion. Now these femoral vessels in the femoral triangle, they pass behind the sartorius muscle in the adductor canal here. This is the femoral artery, femoral vein, and femoral nerve passing through the adductor canal. And when it reaches the adductor hiatus, which is a gap in the adductor magnus muscle, they turn posteriorly to reach the popliteal fossa. And when these vessels reach the popliteal fossa, these are called as popliteal vessels. Muscles of anterior compartment are sartorius, pectineus, iliopsoas, rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius.